Thanks everybody for having us here today at AHP. Today, we're going to actually be talking about a framework that we created around developing a trusted, data-driven, grateful patient program. For those that don't know me or don't know about Windfall, my name is Arup Banerjee. I'm the co-founder and CEO of Windfall. We're going to go really quickly through Windfall as a company, but we've been around for about 5.5 years and have over 700 organizations that actually use us. In terms of today's agenda, though, as I mentioned, we'll just do a quick Windfall overview, and then we're going to be going through actually some macroeconomic giving trends over the last decade or so to really help us understand kind of what is going to happen from here moving forward, exiting out of the pandemic, hopefully, and then thinking about what is the maturity of these various programs and how do we actually consider this working with a lot of healthcare organizations that have given us insights in terms of their own data-driven processes. From there, we will provide a checklist of how you could set that up at your organization as well. And of course, throughout the entire presentation here, we will be able to answer questions through the chat feature, but please do feel free to also reach out to us afterwards if you do have any questions. So to go a little bit more specific into this, and I like to do that as part of the beginning of my entire processes, is that we love to kind of make sure that we go through this analysis of the macroeconomic environment of nonprofits versus all of healthcare, really understanding how you might sit on a data-driven curve. And we have a couple of different phases that we've actually broken this out on. And then what we can go through and actually ensure that this is refined and ultimately used. It's really important that this is not a one-time process, but it's actually an ongoing checklist for your organization. What we won't actually be going through today, we're not going to be talking about Windfall's products and services in detail here. We won't be talking about any specific machine learning algorithms, although we will be talking about AI and machine learning at a high level and what you potentially can use from the data that you're collecting. And specifically, that might not necessarily consider what is the right modeling approach for you in particular as well, depending on what data you have. So if you do have any other questions, again, please do use the chat feature or reach out to us afterwards as well. We're always happy to answer those questions. So as I mentioned, really quickly here, we'll be going through Windfall. Windfall was started in 2016, and when we got started, our vision was to change the way that organizations understood and engaged with affluent donors. We define affluence as anyone over $1 million in wealth. And specifically, we do not provide that as just saying they're more than $1 million, but we'll say, hey, we found John Smith, and John Smith's worth $2.3 million versus a Jane Doe who's worth $49.9 million instead. We update this data every week. And so this data asset is fully ours. And just to give you a sense of the breadth that we have today, we work with some of the leading healthcare organizations across the country. We listed some of them here on the bottom of the slide, but we have over 700 customers nationally as well. And most recently raised some additional capital earlier this year to really facilitate this vision around nonprofit, data-driven, artificial intelligence and machine learning. Now, in terms of my last slide on Windfall, just really quickly, but in terms of the different offerings that we have wealth and patient screening as our flagship product that we provide to all of our customers. You can layer on top of that propensity modeling. So that's the machine learning scores based off of your data and our data. And then ultimately, we also have a product that we released last year to help especially healthcare organizations link their data together. So if you have a patient database and a donor database, how do you know that you have the same, for example, Arup Banerjee in there as well? The unique aspect of Windfall is that we do not price based off of the number of records or credits. We allow unlimited syncs. Everything that we do is an annual contract or longer, and making sure that we can scale with the organization as well. So again, that's really it about Windfall. If you do have additional questions, I'm here after the conversation to answer anything else. So let's get into really some of the work that our team has been thinking about over the last couple of years and how it translates into healthcare and specifically around giving to nonprofits in the healthcare industry as well. And so if we looked at this and we try to make this apples to apples through 2018, there's been some more recent data that's come out, but just making sure that we could analyze it over the last about 20 years and really learn from that based off of what has transpired in 2019, 2020, and today, we wanted to really look backwards. So the first thing is that overall, nonprofit giving is fairly muted when you think about economic declines, right? We actually put the recession aspects here in red, the recovery periods, and then when we consider things to be quote unquote stable. And some of the areas that we saw is that specifically in the last 3 recessions, the decline is not as great as the overall recession, but it's also important to note that as you kind of think about good times, they have seen decreases on top of that. You know, they might be subtle or slight, but we have seen some decreases even in those stable industries. Now, when thinking through this a little bit further and looking at healthcare, we actually did take a look at some AHP reports to really compare this to overall nonprofit giving as well. And you can really see here that as we kind of look at the overall sector, we look at healthcare related and then ultimately to healthcare institutions instead. And so this is still a lot of money that's being donated on an annual cadence. But we wanted to really understand how do those trends compare to some of those macroeconomic environments that we just talked about in terms of recessions, the recovery, and stabilization. So we did put this together as well. On the bottom here, you can see that gray is the overall nonprofit giving, and the blue is the overall healthcare giving as well, based off of that same data that we just displayed. Now, looking backwards, in terms of in 2005, so 15 years ago, healthcare was really outpacing all of nonprofit giving, at least in a comparative perspective. Now, what we could see is that in the recovery year of 2009, everybody didn't actually generate more gifts, even though the economy was quote unquote recovering, and healthcare organizations actually took a disproportionate amount of losses compared to nonprofits as a whole. Now, how does that kind of translate moving forward? Well, we started to then outpace it in future years, but now we're fairly insulated, and that's actually okay. And the volatility associated with these giving trends is fairly muted. That what we can see over the last decade or so. So when we're thinking holistically about the economic recovery, the stimulus packages, and what folks have been giving to, healthcare overall has enjoyed at least not being able to be whipsawed around quite a bit. That being said, of course, we know a lot of the other challenges that are out there. And so as we looked at our data and the broader economic ecosystem, we actually mapped this out up until earlier this year. So through Q2, as we're kind of still in Q3 today, as of this recording, and specifically if we take a look at the S&P 500, you can see that that was that sharp decline over here, and we've had a really nice rebound, at least from a stock perspective. Now, in terms of the GDP growth as well, you can see that there's been some pretty dramatic increases, although people are starting to think about other ways that how that might impact the economic scenario, because of course we have the government, the Fed ending their stimulus packages. We also are seeing consumer demand starting to decline a little bit, and really that's what we're going to be focused on here, because from a fundraising perspective and really thinking about consumer sentiment, that's what we need to really kind of think about a little bit further. So we did a little bit of research on our own side. As I mentioned, we are a data company. We are tracking wealth on a weekly cadence. So we said, hey, what is some of that macroeconomic data that we can actually rely on instead? And so we looked at that same time period through the end of Q2 and really started to think a little bit more about how has wealth changed in the United States. And specifically, what's really interesting is that there's been a massive increase in affluent households. We have over 6 million households in our database that are affluent, but if you think about that, that's incredible because compared to pre-pandemic to post-pandemic, there's a lot of wealth that's actually captured by these folks. In fact, there's been a 25% increase in affluent households, but they're holding a disproportionate amount of wealth for those folks because they've increased by over 30% compared to the 25%. Now, this means that there's over 68% of the wealth in the United States are actually held by high net worth households. Again, that definition of high net worth households is $1 million of wealth, and that's assets minus liabilities. So when thinking about this, even though we saw a decrease in spends in 2020, the affluent in general are actually accumulating at much more higher paces than in prior recessions or prior times when there might be an economic turmoil. So why is it important to really think about this data-driven foundation and ultimately relying on something like a Grateful Patient program to help you augment this understanding? Well, first is that consumer wealth is changing. We've really proven that in the last couple of slides that it is changing on a daily basis. There's wealth creation events, destruction events. There's a lot of things that are out there that, as organizations, we need to start paying attention to. In addition, if you think about this transformation that happened in 2020, it's really hard to break through the noise. Everybody was posting up, articles, webinars, meet and greets, happy hours, and eventually there's a lot of noise there from a digital engagement perspective and a stewardship perspective. The last component is that most organizations, with COVID, and of course, healthcare organizations are in this as well, there's limited bandwidth, limited resources that are out there, and you really have to double down on the things that are going really, really well. So we started to put this together in terms of our framework associated with Grateful Patient programs and how you as an organization might put yourself on the spectrum. So I'm going to keep this next slide up just for a couple of minutes as I talk through these different components of establishing a Grateful Patient program. And depending on where you're at from an organization perspective, hopefully you're at a place where you don't have any data, but you're at least starting to think about segmenting your data and thinking about wealth screening. You might already been doing this, but ultimately you want to start to establish your program with a solid foundation of data. The second phase that we talk about is driving this program further, even more so. And so this starts to think about, well, how do I kind of take my foundation and start to optimize around certain areas where now I want to yield more dollars out of every single investment? This is where you're starting to layer on things like propensity models, machine learning, artificial intelligence. But really, that's not where you stop, because at the end of the day, what you can do with a lot of this data is orchestrate that. And we've seen some of the most sophisticated organizations out there really start to take advantage. And we go through some examples of how you can actually visualize this, how you can start to think about reallocation of portfolios, how you can determine to layer on additional components if you have direct mail programs, for example, instead of just thinking about who might give. And we'll go into some of those use cases. But at the end of the day, engagement, as you're optimizing this, is really built off of actionable insights. It's not just about data analysis and segmentation, but how do you take action at the end of the day? So we have thought about this in terms of going from phase 1 of establishing to phase 3 of orchestrating in 5 specific steps. The first is really, again, creating that foundation of trustworthy data. That's your data, that's other folks' data, whatever you can do to really start to trust that. The intelligence or augmentation, and we're going to go through each one of these, by the way, in more detail, but the second step is really thinking about additional insights that you can start to socialize within your organization. The third is then saying, well, great, I've now created this intelligence on my organization. How can I start to get smarter about this in a more automated perspective? And that is actually leveraging artificial intelligence to then drive action across the organization. This is really important. All of steps 1 through 3 really won't matter until you get to 4, because to drive this across the organization will take some change management, and we have some suggestions on how you potentially can take a look at that. The last one, which again is probably something that could go across everything that you might be doing as an organization, but analyze the results, iterate on it, and ensure that you're measuring how you can improve. That's the orchestration layer that we've talked about on the prior slide as well. So let's go through this step by step and kind of talk about it a little bit further. So step number one here is establishing a foundation of trustworthy data. Now, when we look at a lot of customers and we've talked to a lot of healthcare organizations over the last 5.5 years, we end up seeing a couple of different challenges that folks have seen. The first is that there's a lot of overlapping data, but it's in a variety of disparate systems. And so it's really hard to figure out, again, if I'm a patient or if I'm a donor, if I've attended events, if I've gone through that, how do you centralize all of that information? In addition, you also might have a distributed system where there might be a central hub, but you have different locations or different services, and those folks are actually maintaining their own databases and their own disparate systems, but it's really hard to feed that back up into that central system instead. And so how do we know that if you were in location number 1, but you went to location number 6, but you're not sharing that data appropriately? How do I know how to kind of really take that into consideration? And the impact associated with this is actually pretty large if we're thinking about a donor experience. The first is clunky outreach. If you did not know that that person was a major donor and that somebody just came through the ranks, well, that's not going to feel like that communication is really that unified. In addition, what's about the flip side? You already know about that VIP, but what about all the other folks that potentially could be VIPs? Those high net worth individuals, those individuals that have had a good experience with you and have come to other events. How do you make sure that major gift officers get that opportunity? And then the last one is thinking about, well, how do I think about a household versus the individual patient instead? If we know that there was a very large major donor, but their partner, their spouse came in and we really didn't try to unify a lot of that, well, that might be difficult. And of course, soft credits help here in terms of the way that you might be setting up your database, but linking all that data together for that intelligence is incredibly important so that you do not have a poor experience with potential donors. So how do we solve that? Well, there's a lot of different things that you potentially could do. On the left-hand side of the equation here, we have all of the different data sources that are out there. You could have your CRM, an EMR database, those experiences, the engagement, going to any sorts of events that you might be throwing, but we want to unify that. That's either through looking at common IDs and ensuring that, an Arup Banerjee has 1, 2, 3, 4 across all of those different databases, and enriching that data with additional information to help augment that to drive action. That includes the segmentation, that includes giving folks to major gift officers, it includes potentially modeling down the road. But really, step number 1 is ensuring that you have this unification. And it's not a one-time exercise. This is something that you need to put into place from the very beginning to ensure that you have the most up-to-date information as possible. So this is really a rinse and repeat, which is why we have the arrows going back and forth. All of the data that you're collecting here is going to go into your data sources, and you're going to be able to unify, enrich it, and then take more action from it as well. Okay, so say we did that. We have a unified data set. What will we go and do with that? Well, you're going to start to think about additional information to augment your intelligence, your segmentation, and drive insights. So some of the things that, and imagine that you have a donor here with a lot of different data points associated with them. Really what we want to determine, and you've kind of heard me already say this a couple of times throughout our presentation, but we need to take action on it. And so some of the things that we are collecting, I'm going to say we in the global we of organizations, is experience, engagement, the third-party wealth screens, the likelihood to give. We're really starting to create a lot of that information. But we, in addition, need to think about, well, how well have we done in the past? How do we actually analyze these different cohorts and determine, were there pockets of information that I can really learn from? And specifically, if I have a major gift program and I'm looking for a $100,000 gift, but nobody's ever given me $100,000 before, is that really a realistic expectation from leadership for building out these programs in particular? So the next thing that we really think about is items that you potentially could go on and segment. So a lot of this data is probably data that you're collecting. This is what we've seen from our customers who are collecting this information. And that's really the first layer of insights here that you really should start thinking about as your own data set. And so there's a lot of different areas that can help us understand things around affinity, as well as determining where you can start to standardize this. Now, does that mean that you cannot do any machine learning or artificial intelligence unless you collect every single one of these data points? Absolutely not. But as you start to think about the data that you're collecting, it might be more important for you to think about the consistency over time versus just trying to cobble this together one time. Again, it's all about making sure that this is up to date. Now, the other component, and we'll get into some of the things around modeling and feature engineering, but working to standardize these fields for segmentation and analysis so that anybody within your organization, your teammates, can actually go through and look at this data and they don't have to cleanse it themselves is also really, really helpful. And then the final thing that we have here is make sure you have the discipline. As I just mentioned, you can capture this information moving forward, but having that discipline is really helpful because the accuracy of that information does have downstream effects, whether you're creating those cohorts for segmentation or thinking about predictive models in the future. Now, this is all of your first-party data. If you think about third-party data sets, meaning data that you are not capturing on those individuals, but you can augment your understanding, that's really helpful as well. So once we've unified this data, we can start to think about how you go through a daily patient screening. And you might do a daily patient screening on the folks that are coming in, and then you might take a look at your entire database every month and screen those folks as well. Well, why is that really important? Again, it's for the whole idea of driving action, ensuring that the research process becomes less manual for folks on your team, that your major gift officers are really being able to identify and engage with the right folks, and that you've automated that segmentation process from start to finish. And so this data that you're getting, whether it's from alternative vendors or folks like us, is that you really have to be able to trust that third-party data to build it into your systems. Now, another thing, as you're kind of thinking about step 2 here with the intelligence, is thinking about the different segmentations that you can do from that cohort perspective. As an example, one thing that we've seen customers do and one thing that we've helped other folks do is really looking at your bins and the wealth associated with that to determine where do you want to spend your time, energy, and effort. Just to explain what this graph is on the left-hand side, this is on a log scale, which is why it starts at 10 and goes up to 10,000. And this is a box and whisker plot. So what this is showing you is that this is the median amount based off of the wealth levels within your database. And how broad is that from a percentage perspective, right? Where is the top indicator versus the lowest indicator? And usually you see stuff that goes up and to the right, but in this scenario, if we are working with our cohorts or segmentation, we can say, yep, this is trending really nicely for folks that are worth between 10 and 20 million bucks, but we're actually seeing that the median donation is much lower than the folks that are in the prior bucket. Well, there's a broader breadth here in terms of going to the same area, and then directionally it's up there. So can I steward that a little bit better? Can I think about how to give those folks the major gift officers? Should I change my ask amount? Because clearly as we go up the stack, we also see a very broad breadth on the right-hand side. Now you can start to marry this with some of the other information that you're currently capturing as well, which is the penetration. So taking a look at saying, well, maybe one of the reasons that I'm not capturing as much is because I didn't know about these folks, and we're still missing close to about 40% of the individuals here that potentially could be giving. Or even more so, in the $20 million bucket, well, I have a lot of opportunity there. There's 60% that I really should start to cultivate instead of looking at just the folks that I already know about at the bottom of the funnel instead. So really understanding this data with your first-party data, segmenting it, creating cohorts, applying third-party data, and then visualizing it will really start to think about insights that the team can start to really drive home and see an impact relatively quickly. Now, if we think about kind of that maturity curve, we've kind of gone through the established phase, and now we're starting to get into the drive. And so when we think about driving, that's when we start thinking about artificial intelligence. Now, one of the things that we have heard in the nonprofit community over the last 5 years is that wealth is great, right? Everything we just showed you in that last slide around wealth penetration and buckets is fantastic, but doesn't necessarily mean that there's a lot of philanthropic interest. Totally agree, right? Especially as you have a much larger database of folks to go after, how can you simply spend your time and energy in the right place? So here we've actually listed out 2 different profiles of folks that, would look like they both potentially could be candidates. And here, if you were just using wealth screening, you would say, I'm going to go after this individual first. But they might not necessarily be resonating with your organization, again, based off of your other data points that you might have. And so instead, we look at the person who's actually worth closer to $5 million and say that this was a $10,000 gift that we were trying to go after, and he had a score of 88. Well, maybe I reallocate my portfolio to ensure that I have a 1-2 punch. So using wealth as one of the first factors, but really looking at artificial intelligence or machine learning as the second factor as well. Now, what's really important about these models and artificial intelligence is that it cannot be just for a healthcare model. When we think about, consultants or other folks that come in and they have a healthcare model that's already been developed that you can apply, well, that's not really the greatest thing that you could do to optimize for your organization. Maybe they didn't have a really good experience, so you don't necessarily want to spend as much time there versus a different healthcare organization where they did have a great experience and they have a higher affinity. So using input from your data needs to be in any predictive model that you build. It cannot be a generalized model. And that's what we are really thinking about a lot further here at Windfall as we think about customers, is that there's features, your data, which we'll go into a little bit more on the next slide of what that is, but really understanding that data determines how you can yield the best propensity model for your organization. So specifically, if you don't know what a feature is, that's okay. A feature is just an attribute, it's a data point. And so, for example, a data point could be, when's the first time that they actually gave to your institution? A second data point could be, well, what's the most recent gift that they've given? And now we can use something called feature engineering to say, what's the delta? If it was 10 years ago, then that person has been a donor for 10 years. And really looking at your own data points and creating these features builds a better model. And why is that? It's because we want to ensure that we can interpret this for the organization. If you say, hey, that person's been a donor for 10 years, that's much easier to translate to a major gift officer or to the broader leadership team. In addition, when we think about features, there are a lot of folks out there that say, hey, we put 4,000 data points into a model. Realistically, that doesn't work. And that's what's known as overfitting, because the model is going to, or the data points are going to fit those people exactly the right way. And we don't want to do that because the broader population doesn't have all of those various data points against it. But your features that we're actually engineering based off of these data points will make a lot more unification and ultimately find trends that we weren't able to find beforehand. So let me go through an example really quick. And, without your organization understanding your data, or somebody else who's building this model, whether it's an internal person or an external consultant or a vendor, you really need to make sure that that person understands how your data is laid out. So let's go through a quick example here of data labeling and a feature engineering. And again, if this is a little bit too broad, happy to answer this offline as well. But here's a person that actually was a planned giving donor. So here we actually listed out, yep, they were a planned giving donor. And in fact, they did that first gift in 2012. Here's their age, here's their ID, here's the donations that they've made since that point in time. So we can aggregate a lot of this information and say, hey, this person is a planned giver, but unfortunately, because I have a $10,000 threshold for major gifts, that person actually doesn't satisfy the requirement. So they've only donated $8,000 over the last 5 years, but they're a good planned giving candidate, but not necessarily good major gift candidate. So when we're looking at this various data, that's what we really need to start analyzing, or what you would need to start analyzing, determining what is your goal. Is your goal to create major gifts, or is your goal to create a planned giving donor? And a lot of this information, and again, if you don't necessarily understand features and labels, a label is what we're trying to target, what is the outcome, people that might have given, and the feature is the data set that we're actually going to use. So for a major gift model, we actually might say, hey, this person's a planned giver, 1 and 0, right? That would be an input into the model, versus if I have a planned giving model, having that person being a 1 or a 0 is actually what I'm trying to predict instead, to make it a little bit more simple. Great. So now that we have machine learning, now that we have scores, what do we do with it? What we're actually going to do is take action. And this is not just necessarily on the research team. This is not necessarily just thinking about one specific program, but we really want to take action across the organization. And so we put this framework in terms of the complexity versus the impact. And I think, in terms of as you go up that funnel, as we think about the orchestration layers that we're in phase 3 of that data maturity path, those become much more complex, but the impact is also much higher. So we always try and think about, when you introduce new data into your organization, building consensus, showing them a lot of those graphs, those charts that we had historically is incredibly important. That's when people start building trust, right? When you can start to think about various ways that this data does drive value, that the machine learning models do actually predict an outcome. And then when you implement those programs, hopefully you're going to start seeing more yield. And when you've implemented them, this is really helpful because folks have additional buy-in. Folks are going to then say, hey, what else can we do? And that's when you can go to the orchestration layer instead. So how do we build consensus? Well, visualizations are really great for people who might not necessarily understand all of the various underlying data, or don't have time to go through that process with you. The first thing that we generally recommend for folks to think about is updating this data regularly and creating dashboards on these scores so that people actually understand the distribution. This is, again, on a log scale. So while it looks relatively stable, these have a lot fewer than the folks at the top. So for a Grateful Patient program, you might not have that many people who you can then steward into a major gift program. That's okay. That's actually normal. And if your distribution looks inverted, well, you might have an issue there. And so this really helps say, hey, we did the work and we're starting to build a bunch of confidence. In addition, you can say, hey, we just developed this model, and if we had used it last year, wow, we would have been able to capture the majority of our donors in the top 10% of our scores. That means we would have additional bandwidth to spend in other efforts. And that's what a lift and gain chart do, in fact. It says, if we use this model in the past, how many people will we have captured in the first decile versus the second decile? And then eventually, if we go to the 10th decile, that's the entire population. So you can see in this analysis, if it was a different model versus a newer model, what is the lift associated with that? In addition, what you can start to do for major gift officers, and what we've seen other organizations start to do, is visualize affinity based off of what the major gift officer wants to take a look at versus the propensity scores. And you can put it into different deciles, quartiles, whatever you want to do to make this really simple for an organization, but showing them that if they have a high affinity and a high propensity to give, and you're in this top right-hand quadrant, those are the folks that you really want to start to go after, versus folks that might have a high affinity but a less impact to give. And these X's and O's and circles could be the allocation of that major gift officer's portfolio, and saying, wouldn't you want more stars in there that would be in the upper right hand quadrant, versus having the stars that are over here where they have a high affinity but maybe not a high propensity to give. So this is really, really helpful in terms of the visualizations, and again, building consensus, and then ultimately starting to take some action. So how do we think about implementing shorter term considerations? A lot of folks end up looking at this throughout the database. They might have direct mail programs and look at that initial donation, but there's also stewardship depending on those different thresholds. Again, if it's a quote unquote VIP, versus somebody that could give 500 to $1,000 after a really great experience with your organization. So we talked about grateful patients, we've talked about major gifts, and so that's one of the other items as you're thinking about that maturity curve and starting to think about orchestration. Well, what else can you do with that? Well, you can certainly think about recurring or cultivating annual or loyal donor programs. You can think about reactivating folks that might have given 5 years ago, but potentially are giving much more now, and you just simply don't know about that. We already talked about some of the things around direct mail and creating a response model. Maybe there's some people that are open mail versus not open mail. How do I know that? How do I make sure that I'm spending money the right way? And then, of course, we did talk about that with the feature engineering side. But if you're thinking about planned giving, that might not necessarily be cash gifts. That could be other assets that that household owns. And that's a different model that we would want to take a look at based off of the population that you might have today. Great. So I think we've gone through the really taking action across the organization and then additional strategies that you can look at. But one of the most important components of being data-driven is that you analyze, measure, and iterate. So how do we think about that? Well, I think about this as 3 areas that we really want to have from an ongoing perspective. The first one is technology. So ensuring that you have the technology set up to look at ongoing data, whether that's from data that you're collecting from all of your various locations, disparate systems, combine that together so that you can then augment that with third-party data and then ultimately improve all of your modeling. That feedback loop is incredibly important. It's not a one-time exercise. The second thing is around process. So there are a lot of people in your organization, a lot of stakeholders that have an impact on all of the decision making, and KPIs might change from time to time. That's okay. We should actually take a look at those and refine them based off of where we're seeing success. In addition, we should get other folks who have process improvements, their feedback, so that we can then refine the first step, which is on the technology side. And of course, there's people. At the end of the day, if we think about technology, process, and then people who are actually implementing that, well, you're going to have new folks on the team. You're going to have new major gift officers. You're going to have newer folks that are not used to this. And training is one of those considerations, whether it's from an external vendor or yourself. Building a repository or knowledge base is really helpful. And on that migration, on that up and to the right in terms of the impact and complexity, continuing that communication strategy as you're rolling out new programs is incredibly important once you've started to set up your initial data-driven framework. So there's some additional ways to kind of think about that. I always lean on dashboards as one of those ways that democratize the ability to really measure and think about things. These are usually things that the end healthcare organizations actually building themselves, whether it's something in Excel, Tableau, Salesforce reporting. Any of that information can be really helpful to really determine where you can iterate and help. An easy way of thinking about this is starting to bin predictive modeling scores, and then ultimately how much money are you generating in those various bins. Can you have a running dashboard that every week gets updated or sent out to the team saying, hey, these models still work. We have enough conviction that keep it going. Now, of course, we're going to get contributions from lower deciles as well. But in terms of the capture rate, we're doing what we think we should do. Or once you start seeing something start to fall off on a week-over-week cadence, you can start to think about ways that you might be able to iterate that with internal teams, external vendors, whoever else you might be chatting with, or the relevant stakeholders. And so that's really helpful, including benchmarking it to past performance and then ultimately future performance as well. Okay, so we're entering in the last couple of takeaways, and before we go into a ton more of our Q&A as well. And so specifically, I want to leave up this slide just for a moment again, because it's probably going to make a lot more sense based off of all the 5 steps we really talked about over the last 20 minutes or so. So the first is thinking about establishing, really making sure you have that data and that you can be able to unify that data is going to be step number one on your maturity curve. And you might be already there, and you might be in the driving framework already. And if you're here, you have an outreach program, you have stewardship, you have automated database enrichments, you are thinking about propensity models. And if you're lucky enough to have been going through all of that process, now you're in the orchestration layer, where you really can start to automate, measure, think about other ways to optimize your outreach to other patients or the general population. And that is kind of how we think about how you can get from step one with no data all the way up here with thinking about layering on additional data sets, additional models that will really drive change within your institution. So with that, we always like to end with a checklist, right? We've given you a lot of information. We might have scared you with this huge maturity curve as well, but realistically, it's not that difficult as long as you can have something that you can print out and really look at on a monthly cadence, on a quarterly cadence, to say, have we screened our database? Have we identified all of those constituents? Have we segmented based off of additional data points? Have we updated that information? Those are the types of things that you can start with in that first framework. The second one is you can start to think about machine learning, and ultimately, can that help you think about the population more broadly? Have you set up the right success metrics? Because you might not necessarily know that organizational goal. Again, that's where $100,000 gift, but you've never actually gotten a $100,000 gift. Well, what's realistic? How do we start to ensure that that data is actually measured correctly? And then at the end of the day, those scores need to be updated based off of the freshest data, both your information and any other third-party data that you might be collecting as well. So measure, iterate, think about KPIs and dashboards, but throughout this entire transition, just remember that it doesn't necessarily have to go super long to get from the drive phase, the established phase, to the drive to the orchestration. This is actually a journey that you might be able to do within 6 to 12 months if you have no program at all today. So thanks so much for taking a little bit of time to hear about our approach to a data-driven grateful patient program and how that is set up. I'm happy to answer additional questions, or I also put my email address at the bottom here if you want to reach out to me afterwards. Thanks so much for the time.